Yes, thank you very much for this question. I think it's a very important question because, following the U.S. government cuts in aid to the different ministries of health, I think for us as Sierra Leone, what the government is doing is, first of all, we want to know, what the gap is, the gap in funding, what that gap is. So the government is currently undertaking a gap analysis to quantify what the gap in funding cut is, and to also look at the different programs like malaria, HIV, tuberculosis, RAMCA that is affected in the country, and to also see how they can actually bridge this gap. So currently, that is what the government is doing to be able to, address the funding gap in Sierra Leone. Thank you. Thank you very much. Financing Alliance for Health is playing a very crucial role in supporting the government in Sierra Leone to actually quantify, what the gap is for the Ministry of Health. And I must tell you that we've been able to do a lot already. We have done a lot already. We have been able to assist the government to set up a technical working group to establish what this gap is. We have also been able to assist the government to quantify what the gap is. Then currently what we are doing as Financing Alliance for Health is to actually do a disruptive analysis to look at those different programs that are affected, to compare what was the utilization, take for example malaria, in the previous years as compared to what is happening now, because the US government was supporting malaria, HIV, tuberculosis. So we want to look at what the utilization trend for these different services are now with the cut in funding, and to see how the government now can, reprioritize. So we are doing this so that at the end of the day, we are going to make recommendations to the government to reprioritize. We want to make recommendations to the government to embark on strategic purchasing rather than just doing line item budgeting, but we want them to embark more on strategic purchasing. We want them to also embark on innovative financing, because there are so many opportunities for innovative financing in Sierra Leone, which could bring in more money for health. So those are the kind of recommendations we as Financing Alliance for Health want to propose to the government once we are done with the gap analysis. Thank you very much. Yes, so 3 major priorities for 2026 for the government of Sierra Leone, for the Ministry of Health Sierra Leone. One is to develop the National Health Sector Strategic Plan 2026 to 2030, because the one we had from 2021 to 2025 expires at the end of this year. So we want to assist the government in developing that plan. We also want to assist the government in developing a PHC transformation plan for Sierra Leone, for the Ministry of Health. PHC is one of those pillars that we are supporting as Financing Alliance for Health. So we want to support government in developing a PHC transformation plan. Then what is also top on the priority for the government of Sierra Leone, especially for the Ministry of Health, is to also develop a RAMCA strategy. So these are some of the top priorities for the Ministry of Health for 2026. Thank you very much.